I just start the count on 5, 4, 3, 2, and 1.
Hello. Good
Yeah,
evening. Okay. Good evening, everyone. Warm greetings to each and every one of you present. On behalf of the Department of Social Work, Madras Christian College, I welcome you all to this 3-day international webinar on global trends in mental health. This is jointly organized by the Department of Social Work and the Center for International Social Work of Madras Christian College in collaboration with Commonwealth Organization for Social Work. Madras Christian College is a 183-year-old institution founded by Scottish missionaries in the year 1837. Academic excellence, spiritual vitality, and social relevance have remained the guiding principles in the institution down the decades. The Center for International Social Work of Madras Christian College was established in the year 2007 with aim to promote cross-cultural student and faculty exchange, establish a course on international social work, and encourage multilateral collaborative research with international partners. From the time of its establishment, CISW has hosted faculty of social work from different universities across the globe and about 100 plus students from more than 15 different universities. The Commonwealth is one of the world's oldest political associations of states, with a voluntary association of about 54 independent and equal countries. COSW is an organization for citizens of the Commonwealth who are interested in promoting and supporting social work and promoting social work and social development. It contributes a social work perspective to the Commonwealth activities. Their main goals are development, democracy, and peace. For this international webinar, we are very privileged to have speakers from 6 different continents and participants from both India and abroad. I hope that this webinar will broaden our views on mental health. We will now begin the inaugural function of this 3-day international webinar on global trends in mental health. We will begin with a college prayer. I request Dr. A. Sylvia Dacey to read the college prayer.
O thou, who in days past didst put it into the hearts of good men to found this college, for the imparting of sound learning, the building of character, and the spread of spiritual truth and knowledge of thyself. Bless our college and schools. May love, unity, and brotherhood be learnt here. May industry, uprightness, and courage grow here. And from this place, may there be sent forth continually a stream of men and women who shall serve thee faithfully in thy world. Amen.
Amen. Thank you, ma'am. The welcome address will be given by Dr. Miriam Samuel, Head of the Department of Social Work, Madras Christian College. Dr. Miriam has been the head of the Social Work Department since 1993. She's an expert in the ideas of curriculum development for social work. She's conducted various gender training programs and mental health programs for different groups. She has also initiated a number of international collaborations. Ma'am has been teaching on topics related to mental health since the year 1989. She has been a pillar of strength and encouragement and a huge support to the department and the students since its inception. I request you, ma'am, to give the welcome address.
Thank you, Sylvia, for those nice words. Very warm greetings to all our special guests, special invitees, speakers, and participants. It indeed is a very special moment for me and my colleagues in India and our colleagues from the Commonwealth Organization for Social Work in UK to welcome you all to this joint international webinar on global trends in mental health, which is being hosted from today to the 29th July. I bring you warm greetings on behalf of all the organizers to this webinar. We do know, and we've heard this very many times, that we are in challenging times with the global pandemic. But out of this arise innovative practices, strong bonds across lands and nations, cohesiveness, and community resilience. What better way to stand together in solidarity as social workers to respond to the challenges that this COVID-19 pandemic has created for all of us, irrespective of our caste, creed, gender, nation, nationality, or economic standing. We have seen that COVID-19 is not just a public health issue, but we understand that mental health challenges are huge at this point of time. Beulah has very beautifully told us about Madras Christian College, which is 183 years old, and an institution that is ranked among the top 10 institutions in India today, standing on the principles of academic excellence, social relevance, and spiritual vitality. Aligning with the principles of social relevance, the college from its inception has responded to the needs of our neighborhood communities and to issues of social justice and human rights, be it education for Dalits or from those marginalized communities, gender education, and responding to the needs of poorer communities around us. The inception of the department in 1989 furthered this by moving from just service to professional training and practice at Madras Christian College. Today, the Department of Social Work, with all humility, I say, stands among the top 10 social work institutions in India. And this year, we were ranked 7th in India. A small beginning, a small department, grounded in our faith and spirituality, standing up for justice and rights of all peoples and communities. We have also, over the last 20 years, as Beulah mentioned, built up our international collaborations and established the Center for International Social Work. And we have a number of collaborations across the globe, including, to my UK colleagues, the Liverpool Hope University and the Canterbury Christ Church University in UK. And I, as head of the department, see this webinar as a step towards this endeavor of building and furthering our relationships and collaborations globally. It is with this introductory note that I'm delighted to welcome all of you, and very especially into our midst, Dr. David Jones from the Commonwealth Organization for Social Work UK, Commonwealth Institutions UK. Dr. Godfrey, who is the Policy Research and Practice Improvement Lead, British Association of Social Workers UK. Dr. Tatiana Taylor from King's College London, UK, and our very own Mr. Sri Ganesh, Vice President of the Asia Pacific region, IFSW, India. It's also my duty to welcome into our midst our principal, who has not been able to join us as yet, as he's in a government meeting, Dr. P. Wilson, who's very recently taken over as a principal of the college, our webinar coordinator, Dr. Annadore, and very specially, Dr. Sylvia Dacey, who is here as a representative from the COSW and also from the Department of Social Work in the self-finance stream in Madras Christian College. A warm welcome to all the chairpersons and all the speakers. Special mention of Dr. R. Srinivasa Murthy, retired professor of psychiatry from NIMHANS, India. Ms. Naomi Spencer, Vice President of the New South Wales Australian Association of Social Workers. Mr. Theo, Chairperson for COSW Malaysia. The reason why I mentioned it is for us to see and understand that this truly is a network of various associations and networks for social workers globally. This definitely is a special occasion for all of us of coming together of these global associations of social workers to share and to learn on a common platform. And I think this has been possible only because of the situation that we are in. I hope that all of us will be able to think globally along with all our global speakers, both from India and the other continents, and to act locally in responding to the mental health challenges that we see around us at this point of time. I hope and pray that you all have an engaging and enriching session over these 3 days. Warm welcome once again. Thank you all very much, and God bless.
Thank you, ma'am, for those warm and relevant words of welcome. Now we will move on to the special address. For the special address, we have with us Dr. David N. Jones, the COSW representative of the Commonwealth Institution. Dr. David is a consultant, author, researcher, practitioner, and a speaker. He was the president of the International Federation of Social Workers from the year 2006 to 2010. Sir has an extensive experience with national and local government, NGO sector, and private sector. He was the General Secretary of the British Association of Social Workers from the year 1985 to 1994, and the Director of Operations of the Central Council for Education and Training in Social Work. He has also worked for the Audit Commission, the Department of Education and Skills, and the Department of Health in the UK. We are very honored to have you, sir. Thank you for joining us. Over to you for the special address.
Thank you very much for your warm welcome, and it is exciting to be here. I am not at home, I'm on holiday, but in North Wales in the UK, and the rain is pouring outside and the trees are beating around with wind, and that is affecting the internet signal, but I hope that we can keep in contact through this short address. I am very excited by this connection, and particularly as Shri Ganesh has just been elected a vice president, then it's a historic moment for India. So I'm going to share my screen now and start. It's gone to a picture that I wasn't expecting, so I'll go back to the beginning, and you can see. There we go. That's me, and sorry about that. But this is me, and I'm just going to say something very quickly about social work in the Commonwealth. So the Commonwealth Organization for Social Work started in 1992 when Anthony Tan from Malaysia had a Commonwealth fellowship, and he started exploring how social work could have a stronger voice in the Commonwealth. And we had a meeting in 1994 in Colombo at the International Federation of Social Workers meeting there, when the various representatives of national associations said, yes, we think we should explore what should happen and that social work needs a voice in the Commonwealth. So we started talking with the Commonwealth Secretariat and the Commonwealth Foundation, and we attended the Heads of Government meeting in Edinburgh in 1997. And in 2000, at the IFSW conference and general meeting in Montreal, we agreed a constitution. And in 2005, we were registered as a company in London. So we are a formal organization crossing the Commonwealth. There have been many heads of government meetings in the Commonwealth. And one of the special things about COSWA is the Commonwealth Organization for Social Work. We have the right to be present with the heads of government at the Commonwealth meeting. And here I was representing social work in Buckingham Palace with all the heads of government in 1997, with Queen Elizabeth making the opening speech. But not only that, we can sit in and watch the foreign ministers as they are sitting around the table talking about social policy and other things. So our organization gives us a privileged access to make sure social work can connect at the highest levels. Anthony Tan on the left, the picture there, was the first chair, and he was the founding member of the Commonwealth organization. And I will not mention all the names, but you will see that as we have gone on, we have had members from many countries in the Commonwealth on the board. And here is the current board chaired by Teo, who will be speaking in another session. We have Canada, New Zealand, Kenya, India, Australia, Canada, and Ghana represented on our board. And we have various activities. We are accredited to the Commonwealth institutions, which means we are recognized as a professional body, and we have a voice round the table at many meetings. There is an independent forum of Commonwealth organizations, which we have been involved in setting up, and I am on the steering group, and Godfred supports me in working there. And we have connections with different groups that represent different interests. So there is a network of health bodies, there's a network of urban planning, and we are involved at Marlborough House, which is the headquarters of the Commonwealth, in a number of consultations, and we contribute to the priorities and the work plan, and we meet with heads of government. So what have we seen over these 2 decades? COSWA is a very small organization. It is almost entirely relies on voluntary activity, but there is a lot of enthusiasm across the Commonwealth through the networks, and we have raised the professional profile of social work, including within the COVID crisis. It's been hard work, but with our links with the International Federation, we make sure there is a consistent voice for social work. And at every head of government meeting, we make sure that local people are representing social work there and they have access. And we have a lot of potential for developing projects. But we now need to relaunch the Commonwealth Organisation for Social Work and make sure that more people are involved. Just to finish, one of our projects has been with young carers, young people who are caring for their parents or their siblings who have disability or who are ill. And this has mainly been in East Africa, where we've had a series of festivals and conferences involving young people. And we are now working on a Commonwealth Young Carer Charter, and an organisation from India is connected into that. And we run after school clubs. But one of the strengths of the Commonwealth is that we may ensure that young people can meet ministers. So here, back in 2006, 2 young carers are meeting the Minister for Children in London when they were setting up that event. And here is the poster for the Young Carers Festival last year, which is working towards a new manifesto. And we now want to broaden the links to include young carers groups from Asia. And we can do that through the internet. Here is a group of young people in Nairobi connecting through the internet with young carers in UK, sharing their experiences and talking about their shared and similar experiences, even though they live in different environments. So it does work. The Commonwealth Organisation is making sure that the voice of social work is heard in the places where it matters. And this is how you can contact me. And between us on the Commonwealth Organisation for Social Work, we thank Madras Christian College for this webinar and wish everybody success in these important discussions. Thank you very much.
Thank you, sir, for giving us a brief orientation of the Commonwealth Organization for Social Work, and for also letting us know how it contributes to the social work profession. It has helped us understand COSW a little bit more better. Thank you, sir. We have with us Dr. Godfred Bowen, the Policy, Research and Practice Improvement Lead of the British Association of Social Workers, UK. Dr. Godfrey is the author of 2 books on social work. He has also published on social work in Africa. Sir is currently writing a chapter in the Encyclopedia of UN Sustainable Development Goals on the role of social work in meeting the Sustainable Development Goal on poverty. He is also a board member of the journal Practice, Social Work in Action, and the Commonwealth Organization for Social Work. We are privileged to have you, sir. Over to you for the special address.
Hi, Bula. Thank you very much for that wonderful introduction. I want to say another thank you to our distinguished guests from Madras Christian College for just organizing this innovative conference, which is really giving us social workers from around the globe the opportunity to really share our experiences and also reflect on the lessons for social work from confronting the current COVID crisis. I also want to say a very warm welcome to our audience from around the globe, and also to students at MCC who have done so well to organize and coordinate the conference. Now, in this short address, I want to focus on some common issues that social workers within the Commonwealth who work with people experiencing mental distress all confront. And then in the conclusion, I want to share some thoughts on the values that underpin our practice, but the values that we can all also share to enable us to confront our respective challenges. And there's a reason why I am doing this. You will note from the program that each of the sessions in this groundbreaking conference is dedicated to a specific region of the Commonwealth. While this ensures that we're able to focus and do a detailed analysis of the issues within that particular region, the downside is that we're not able to identify shared analytic threats across the Commonwealth. And so I'm trying to address that gap in the approach that we're taking. And I want to start by providing an overview of the mental health issues within the Commonwealth. As has been mentioned by Bula and others, the Commonwealth is an organization of 54 countries with a combined population of about 2.4 billion people. Of course, one issue that we have to address straight away is that the Commonwealth countries all share a history of British imperialism and a legacy of colonialism. And that itself has left behind a residue of racism and institutional and structural discrimination, which still resonates with us today. However, as an international organization, the population of the Commonwealth is about 1/3 of the world's total. It contains some of the most advanced and rich economies in the world, rising powers like India, small island states in the Caribbean and the Pacific who confront natural emergencies such as hurricanes and rising sea levels caused by global warming. So it's safe to say that the mental health systems of the Commonwealth countries are broadly representative of the globe. And what I'm saying next might be an oversimplification, but it's helpful for analytic purposes, which is that within the Commonwealth, we can group the countries into the sort of ABC countries, that is Australia, Britain, and Canada, who are the richer global North countries, and the non-ABC countries, who are the less wealthy global South countries, and they also happen to be the majority. In 2017, the World Psychiatric Association conducted some research into mental health policies within the Commonwealth and uncovered some very interesting findings, which I want to highlight and also use as the backdrop to my presentation. Their research found that only 48% of the countries in the Commonwealth have mental health policies. But interestingly, the low-income countries are more likely to have mental health policies than the high-income countries. I also want to quote some further data from the research because it's so useful to the argument that I'm making. The first is that of the 48% of countries that had mental health policies, 72 of them were adopted before 2011. So it's fair assumption and also inference to make that the mental health policies of the Commonwealth countries are not contemporary, and they would continue to show the structures and the practice rationale dating back to the period before independence. Another important finding from the research is that Commonwealth countries tend to prioritize funding for physical health services over mental health services. This is really important because as we confront the long-standing impact of COVID, this sort of disparity in funding between health services in terms of disproportionate focus on physical as opposed to mental health would continue and will remain with us. And we need to think about that as practitioners, academics, and policymakers about how we address that funding disproportionality. And then finally, in terms of human rights, only 68% of the countries involved in that research promoted human rights, and only 14% of them specifically mentioned developing a human rights framework for their mental health policies. For social work practitioners, this is a really important finding because social work is underpinned by the principle of human rights. And therefore, we already have a disjuncture and a tension whereby social workers are being influenced by human rights approaches, and yet the services in which they work are not specifically orientated towards human rights. So there's a tension there that we need to confront. One final conclusion I want to draw from the research which I have just discussed is that it shows to us that within the Commonwealth and perhaps globally, the wealth of a nation does not necessarily equate to the effectiveness of mental health services. And it doesn't always equate to how it deals with people experiencing mental distress. Moving on to a different topic, that issue of poverty. We know that within the Commonwealth and also globally, there's a link between poverty and the rates of people who experience mental distress. We also know from the research that there is a connection between the mental distress experienced by particular sections of the population. They themselves are also more likely to experience multiple discrimination, which then also increases their risk of mental distress and other health inequalities. And examples of these groups are people who are experiencing physical and cognitive impairment, ethnic minorities broadly defined, and people of different sexual orientation. So in conclusion then, what I want to highlight is that there is an opportunity for all of us practicing both in the global South and in the global North to share our experiences and our knowledge to really confront those common difficulties which I have outlined in my presentation. The global North and global South both have deficiencies in human rights practice framework. However, the global North has arguably a more formal and legalistic and liberal democratic framework to human rights, which is also underpinned by individualism. However, global South countries have an understanding of human rights based on communitarian principles. And if we were to combine these two perspectives, we then will be able to develop mental health services across the Commonwealth which are underpinned by human rights, but which nevertheless respect the cultural diversity of the users of mental health services. And this would help plug and also eliminate some of the discrimination currently practiced by services. So a final thought also is that we need to, as practitioners across the Commonwealth, we need to consider how we can draw on technology to really enhance the delivery of mental health services. And I hope that there's an opportunity for us all to engage in the debate around precisely how we can use these technologies in the delivery of services. So I want to conclude by just again saying my gratitude to MCC for organizing this groundbreaking conference, and also expressing my expectation and joy that we'll have the opportunity to learn and share our common experiences across the globe in these 3 days. So many thanks, and I'll now hand over to Buna.
Thank you, sir, for throwing light on the background of mental health policy and also relating poverty and mental health. You've also touched upon how we can improve mental health services. It was indeed an interesting address. Dr. P. Wilson, the principal and secretary of Madras Christian College, is also a professor of the Department of Chemistry. He was recently appointed the principal, and despite the challenging current circumstances, he has been leading the institution passionately. Being an avid researcher, one of his recognized contributions is the initiation of the MCC Research Colloquium. Sir was to join us for the felicitation, but due to a sudden unexpected official meeting with the government, he is unable to join us. However, he sends his greetings and wishes for the success of this webinar. Now moving on, for the keynote address, we have with us Dr. Tatiana Taylor-Salisbury from King's College, London. She's a lecturer and a public mental health scientist. Ma'am uses human-centric design to help health and community service providers in low resource settings by actively engaging young people in the development of sustainable solutions by positively to transform their health, wealth, and relationships. She will now give us the address on COVID-19 and the global mental health response. Thank you, ma'am, for joining us. Over to you for the keynote address.
Thank you very much. Let me just get this in full screen mode. Great. Thank you everyone for inviting me. I'm very honored to be your keynote speaker for today. I am here to talk about mental health and the response to COVID. So the things that I want to talk about today are, one, why should we care about the mental health impact of COVID? And I hope that during this talk, I'll be able to, if you aren't already in agreement with that we should care. I hope by the end of this talk, you will agree that it is an important consideration in terms of COVID. And then secondly, then what can we actually do to strengthen our mental health response? So first, I'd like to start by giving a brief overview of mental health. So if we think about mental health and its impact, although it's something that isn't very widely discussed amongst people, it affects quite a lot of us. 1 in 3 individuals will experience a mental health condition during their lifetime. And we also know that adolescence in particular is a very sensitive time and vulnerable time for mental health issues, with 50% of mental health conditions starting before a person's 14th birthday, rising to 75% starting before their 24th birthday. So we now understand that childhood and adolescence are key periods in time to creating a very strong foundation for resilience to mental health problems. But there are risk factors that make a person also more vulnerable to mental health problems, and those include poverty, poor education, gender discrimination, poor nutrition, the experience of natural disasters, violence, or conflict, and poor physical health. And we know that poor mental health affects not only your mental health, but also has impacts on social relationships, on educational attainment, and also then as a proxy on economic prospects. So despite the high prevalence of mental health problems and the significant impact it has not only on the individual's lives, but also the lives of their families and their communities, only on average 2% of government budgets are spent on mental health. And if we also think about the provision of mental health services and care, the human resources available are also very ill balanced towards the problem, with fewer than one mental health professional per 10,000 people worldwide. And in some places, you might have a very small number of mental health professionals within an entire country. So this causes huge problems for the prospect of providing adequate care and also ensuring that those with need, that those needs are met. So if we go back and think about those risk factors for mental disorders, let's now talk about COVID. So COVID is really important, not just in terms of the mental health of those people who contract COVID-19, but also around the restrictions that it had now really had an impact on the majority of people's lives across the globe. The restrictions to our daily movements and what we're able to do within our lives have seen an increase in social isolation, in financial instability with people unable to work, because they can't leave their homes or because work is no longer there for them because people are no longer allowed to visit premises. Also potential for increase in household conflict. So conflict as a result of the increased anxiety and stress of the situation, but also potentially an increase in domestic violence that might have already been present within a household. There's also then been a decrease in employment, also a decrease in health help seeking. So not just around COVID, but people who would normally go and see a GP or go to a hospital for care are staying away because they're afraid of contracting COVID. And that is having knock-on impacts of other health conditions. There's also just the greater uncertainty around future and what people are going to be able to do and what livelihoods might mean. And for young people, there's a severe impact on educational opportunities, with very young people not being able to attend school, and as well as adults in universities unable to attend. And also the availability of remote supervision or remote teaching, and who has access to remote teaching and who doesn't as a result of the availability of electronic equipment. And as a result, we've been seeing in headlines across the globe the kind of bubbling up of mental health and the impact of mental health on people. So I've been quite surprised, although it's not surprising now, that people are really coming around to the importance of mental health in general, because it seems to be impacting so many of us just because of the restrictions under which we are all living at the time. So what can we actually do now? So we know that mental health is a big issue in terms of COVID response, and should then be something that we're thinking about, not just in isolation for COVID, but also in in preparation for other pandemics that might come in future, and ensuring that we have a very strong baseline and foundation of mental health care so that we're able to deal with fluctuations of need in future. So the United Nations has come up with a policy brief on COVID and mental health, and what they are arguing for are a three-pronged approach. So the first bit is to apply a whole of society approach to both promote, protect, and care for mental health. And this then includes the incorporation of mental health within national response plans for COVID. For example, within the response for education, and ensuring that mental health needs of individuals are met within other non-mental health response plans. Then in reducing adversities that are related to the pandemic. So for one, acute poverty, so those who are being immediately impacted by the loss of their financial livelihoods, and also around domestic violence. Secondly is ensuring the widespread availability of emergency mental health and psychosocial support. So the importance of really supporting activities that encourage social relationships, also investing in evidence-based interventions for mental health that can be delivered on a remote basis. Then ensuring also the continuity of care for individuals with severe mental health conditions. So we have to remember that there are still people with severe mental health conditions that are receiving treatment, and that treatment should not end. So we must ensure that there is continuity of that care so that they are not left in the dark at this point in time. And then importantly, and this goes on to what Godfred was speaking about, protecting and ensuring that we protect the human rights of those with mental health conditions. So individuals with mental health conditions also need to be taken care of and ensured that they have access to COVID healthcare in case they contract the illness. And then lastly is on support for recovery for COVID-19. And this is around thinking about the future of mental health services. So really taking this time as a wake-up call for all of us and really advocating for the importance of supporting and shoring up mental health services at a national scale within all of the countries in which we're living, and also advocating for those countries that we are not living within. The importance of making sure that mental health care is included in any effort towards universal health care, and the importance of strengthening human resources. I've mentioned previously that human resources for mental health are severely impacted, and this has a significant impact on what we're able to do in terms of providing mental health care and also detecting issues as they appear within the population and amongst individuals. Then also continuing to ensure that these services uphold the human rights of all individuals. And lastly, which comes back to where my research in mental health has gone most recently, is around ensuring that people with lived experience and expanding that to the communities in which interventions will be delivered are actually actively involved and engaged in their design, in their implementation, and in their monitoring. And we know that this is key because we are talking about two things around supply and demand. So we can make sure that there are enough mental health human resources and enough services to cover a population, but without ensuring that the demand is there, there's no point, because if people will not turn up to receive treatment or are hesitant about receiving treatment because of stigma or because they feel that the interventions actually don't make any impact on their lives and their priorities and goals, then there's no point. We're just wasting money. So it's a two-pronged approach on providing services, but also making sure that those services are things that the people in the communities which we're hoping to reach actually want. So community partnership is really vital. So why are these proven interventions? So we've spoken about this, that there are evidence-based interventions that work, and they've been shown to work through research, but they're not widely available. And why is this? So in terms of interventions, but also expanding to policies and plans, these are largely developed traditionally from the top down, which means that experts then decide what are the important aspects and what are the components of interventions and how they might be delivered. And then they are fed to people below who are going to receive those, and also those individuals who are providing interventions. And we say, look, this is what you're supposed to do. Now go off and do it. But without much input, or with limited input from those and buy-in from those that are being directly targeted or who are responsible for provision, it is not a sure thing that these interventions will actually be available. So in my own research, I've been tackling this prospect of how do you ensure that interventions are actually welcomed and wanted within a community. And the method and the approach that I use is one called human-centered design. And this places the human, or the target, in this instance, it would be the individual who is in need of mental health care, or the wider population who are just in need of mental health promotion and prevention interventions, at the center. And what we really want to do is to understand, one, what are people's motivations around mental health, and what generally that they want in their lives, and how we might then mold interventions to meet those motivations. Looking at their existing beliefs. Are there incorrect beliefs that we can try to address, or are there beliefs that actually we need to work with and think about in terms of developing interventions? And finally, individuals' behaviors. What is it that they do? So instead of trying to make mental health interventions something that we say, you need to come to us, you need to go to a health facility, we need to look at where do people go when they're experiencing symptoms of mental health problems. And then working with where they're already going and the behaviors that they're already providing to ensure that interventions are embedded there, so that we're not asking them to do and step out of their comfort zone, but we are instead coming to them. We need to be very clear and working with the communities about what we aim to do. So what is the shared goal and the shared vision? Without a shared vision, there's a way of leaving people behind and making people feel that these interventions are not for them. And so we're then effectively cutting out a segment of the population from accessing these treatments and interventions. We need to know what people's experiences are. So we need to collect data. So whatever we're doing, we need to know, are we actually helping people? Are people coming, and are they partaking in interventions, and are those interventions working for them? And then thinking about what interventions they should be. And this is something that then actually should be a whole community and key stakeholder activity. This is something that everyone should be able to engage in, and also to share their own ideas and thinking. The simplest answer is the one that we want. We don't want complex things. These are complex problems that involve lots of people, and we can't solve them without having a whole range of disciplines, a whole range of experiences involved in finding those solutions. And so what are the pros of using a human-centered design approach? One, I think it increases the feasibility, the appropriateness, and the acceptability of any intervention that you will then come up with, because you're doing it with all of the key players, which will have an important role in ensuring that intervention is scalable and sustainable. Two, it automatically embeds a flexibility into the implementation, because we're not coming in and saying, we know what's right and this is what you need to do, but instead working together in a fashion that really tries to work out what is most appropriate and most effective within a community. Then we have this ability to be flexible. We're not stuck and static to a particular intervention or in a delivery process. And so in doing that, if by any chance an intervention that is working in future starts to not work as intended, there's then an ability to step back and say, well, what isn't working here, and how can we ensure that we tweak that, so change it or adapt it to ensure that it does work, Or maybe we have to say that actually the needs of the community no longer match this intervention and we need to find a new path forward. And then lastly, and I think really importantly for mental health interventions, is that this might get around stigma. We know that worldwide, in all cultures, in all countries, mental health is attached to an enormous amount of stigma. This is stigma on the individual, as well as stigma of people who come in contact with that individual, either within a household or a family, or even in the professions that help to support those individuals. So including all of those individuals within an intervention and that delivery and development, we might then come up with ways in which to get around stigma and make those interventions much more palatable and appealing to individuals who are in receipt of interventions, as well as those who must deliver them. So what does that actually look like? And this is one of the kind of last things that I'm going to leave you with. I use a method called design thinking, which is a type of human-centered design that is comprised of 5 steps. So the first one is to empathize. So it's really listening to your key stakeholders to understand their experiences, understand their challenges, and also to know what their priorities are for the future. And we can do this usually by qualitative research, in conducting one-to-one interviews, in having focus group discussions, also by looking at the existing literature, so doing desk research, and also mapping the existing services within a setting that is available to your target audience. In projects that I've worked on, we've also used photo voice as a way of observing individuals, so allowing them to take control and take photos of things that they think are important to them in their lives, and using that then as a visual and also a way in which to tell stories and to reach people in that way. And we found that to be very effective. We then move on from the empathize stage to one of defining the problem. We might already know generally what we're trying to do. Maybe that's, in this case, improving mental health outcomes. But what exactly is the problem, the specific problem that we're trying to address? Without knowing what the specific problem is and without having a consensus on that problem, it becomes very hard to agree what an intervention should be. So that's a really critical moment. And then after that, we come to the more creative aspects. So this is the ideation phase, where we're brainstorming what are ways in which we might solve this defined challenge. And that is done across all of the stakeholders in workshops where we bring people together and we talk about what are things that maybe some people have done individually to overcome issues that they've had that might be relevant to people more generally. And also just to think of really wild and daring ideas, which might not completely be feasible, but there might be aspects of those ideas that we can take and tailor into a new intervention. And then the key thing here, I think that is very important and really comes out, this human-centered design approach comes primarily from the private sector in its original form, is around prototyping or beta testing, coming up with models. It might be, in our case, storyboards. It might be small tests or visual ways of showing people what this intervention might look like. Because it's hard to really get someone to say what they want something to look like without showing them. So then they can automatically say, oh, I wouldn't go to that person to talk about this. Or have you thought about, maybe going and working with the churches, or going to this community activity that all young people go to after school, and maybe this is where an intervention should be embedded. So we're thinking not only about the intervention components, but also about the delivery strategies and the mechanisms in which we get that intervention into the public sphere. And then lastly, around testing. And this is where we come back to the more kind of traditional research. So there might be pilot testing that goes on once we know which prototype we want to work on. and then going on to randomized controlled trials to gain more concrete evidence that is useful then for governments in terms of scaling up. In any of these phases, we might circle back and go back to another stage because we might find a gap in our understanding and we might need to then go back to the drawing board. So this is an iterative process that really has the flexibility in mind towards scale up. And the idea is that then when we get to the end and we find an intervention that is effective, it's also accessible, it's appropriate, and feasible, and it has the best chance for scale up and making kind of real impact in the real world. So in closing, I just want to come back to my key messages. So if you've fallen asleep, now's the time to kind of perk up and come back to it for this last minute. So one is just to remember the importance and the impact that mental health has been highlighted by COVID-19. Opportunity for us because mental health is really coming to the forefront. People are feeling this, they're seeing this, they're understanding that mental health is an important thing. And we all need to join to advocate and capitalize on this moment to ensure that we can provide really strong mental health support now and in future. Second, the great thing is that, due to all of the efforts of many of you and other researchers around the globe and practitioners, resources and evidence-based interventions are available to support mental health. So we don't need to reinvent the wheel. We can go back and find what is existing and build on that. But the key thing is that any action that we do, we must partner with those who are most impacted and also most vital to its success. So those are individuals with mental health problems, their family members and caregivers, also the service providers who will be asking to deliver these interventions. They must all be engaged. And without this, there's no way I think that we're able to succeed. But with this, with us all working together, we are in a very good position to make significant strides towards improving mental health outcomes for everyone around the world. So thank you very much. And I look forward to the rest of the 3 days of the conference.
Thank you so much, ma'am, for covering the important aspects of mental health and for stressing on our roles in promoting the mental health care. Thank you for also throwing light on the human-centric design approach. I'm sure it was interesting and new to all the participants. Thank you, ma'am. Dr. P. Wilson, the Principal and Secretary of Madras Christian College, has joined us. Thank you, sir, for joining us despite your hectic schedule. We are honored to have you in our midst. I request you, sir, to give the felicitation.
Thank you. Sorry, I'm traveling, but I make it a point to address the gathering. Thank you for inviting me. It's a privilege. I was just listening to the previous keynote address. And as we get into this new normal, the term that we normally use, new normal, that after the post-COVID situation, quite uncertain situation that we're entering into, the new dispensation, we can call it as. One of the threats that I find out, or a conflict that I find out, is the mental health management. If you look into the business enterprises, there are two problems. One is presenteeism, other one is absenteeism. Absenteeism causes stress, which everyone knows that. And presenteeism causes a dangerous threat. Now we are just having a conflict between these two, how to manage. I think at this context, conducting a webinar or an international webinar on such topic on mental health management is going to be a very important aspect for the social work students. And now looking at the way the absence of employees are managed in the industries, if you look into that, they have a business tracking system. And now after the post-COVID situation, now we have to move into the new normal where it is a business intelligence system. It's not a business tracking system. What do we mean by business intelligence system? Now we are in the era of artificial intelligence where we have to look into the predictions now. So health predictions becomes very important now after the post-COVID situation till a vaccine is identified. So as students of social work department, we need to understand that artificial intelligence plays a vital role, and even artificial neural networks plays a vital role. I was even requesting one of your faculty members to talk about this particular aspect of the role of artificial intelligence in social work or in mental health management. And I think we are now struggling between the conflicts of presenteeism and absenteeism, and the whole world is trying to have a conflict between employee well-being and business liability. And the whole the government is struggling between the conflict of the mortality and the economy. Now, in all these conflicts, I think how are we going to manage the whole system? That's why we talk about the management systems now. So as a social work students, I request all of you to get into the new updates where the knowledge of social work has to be updated with the technological updatements too. And I wish all the best in all your endeavors, because I see that when I go to the list, I find out that social work department, the ADHD team has conducted many such activities, around 8 to 9 activities. And I congratulate the organizers for having taken up such initiative and kind of an extended learning during this lockdown. And I wish you all the best. Thank you.
Thank you so much, sir, for your relevant and kind words. Thank you for always encouraging us and supporting us in all our endeavors. We have with us Mr. Sri Ganesh MV, the newly elected Vice President of Asia Pacific region of the International Federation of Social Workers. Mr. Sri Ganesh MV is a graduate in science and a postgraduate in both social work and law. Sir has played a key role in the formation of India Network of Professional Social Workers Association and initiated steps to get it affiliated to the International Federation of Social Workers. Sir has also practiced law in both labor courts, industrial tribunal, and High Court of Karnataka, India. He is an expert in the areas of labor welfare, social security legislation, employee relations, HR audit and compliance, gender sensitivity, and CSR. Thank you so much, sir, for joining us. I request you to give the felicitation. So
Hello,
you have
everybody.
to yes, sir.
Hope I am audible now.
Yes, sir.
Dear Dr. Jones, David Jones, one of the pillars of Commonwealth Organization of Social Workers and a very dear friend of mine who is chairing this inaugural session, Professor Wilson, the principal, who gave a very brief but very, very pertinent and very important message to all of us. Professor Miriam Samuel, head of the Department of Social Work, Madras Christian College. Dr. Prince Annadurai. Dr. Teo Aihua, the present chairman of the Commonwealth Organization of Social Workers. Dr. Titiana Taylor, who delivered an excellent keynote, bringing this sort of COVID impact and then what sort of interventions we need to look into. And Dr. Sylvia Dicey, and my dear students and the professional social work colleagues cutting across countries. Firstly, I would like to congratulate the Department of Social Work, Madras Christian College, for having organized this 3-day event in association with Commonwealth Organization of Social Workers. COVID has thrown a very, very difficult challenge to the whole
Sri Ganesh, sir. I think we've lost, sir. We'll move on. In case if he joins back, we will resume it. The final felicitation will be given by Dr. Prince Annadurai. I think sir has joined us.
Yeah, I think sir is back. But over to.
So you can take.
Yes.
So your voice is muted. Sri Ganesh, sir.
Hello, sorry for the disruption. The power went off, I think, and I had to log into the hotspot here.
Okay.
You're able to hear?
Yes, sir.
Yeah. Now, what is the real impact of COVID in an Indian context? I'd like to be very brief. I'll take about 3-4 minutes, not more than that. One is there is a big impact on the whole economy. When I say whole economy, the projections in terms of the negative growth of GDP is going to be between 5 to 7%, which is enormous. And the loss of jobs, according to one of the surveys that was done during COVID, has been about 130 million, which is an astronomical figure if you compare it to some of the nations where the population is not even half or 1/4 of that. And what is the effect of this? There have been job losses. Livelihood options have become very, very difficult. And the people will be pushed to the below poverty line. Even those people who have been brought above the poverty line will be pushed back to the poverty line. So the poor people are going to be much more, maybe about 350 to 400 million will be in that bracket. It is very difficult for the government to look at the sort of support services they need to have. Now, what is the impact of COVID on the social aspect? The families today are facing the challenges. Families are not able to celebrate functions. Their children are not able to go and play outside. We are not able to attend, any function outside. The youngsters, you would have enjoyed going to a cafeteria and having a cup of coffee, sitting around a table and discussing various issues, making fun. Today that cannot happen. So there are relationship issues, and there are going to be challenges in terms of anxiety and stress. Both put together is going to create a lot of mental psychosocial problem. Psychosocial issues like fear is going to be creeping in. Anxiety is going to be creeping in. We are going to have more people with depression. Today morning, I was reading an interview by Dr. Gangadhar of Nimans, who said that for the last 3 months, they have received, their help center has received about 350,000 calls, wherein none of them were seeking any assistance earlier. But now they all want some sort of assistance. The fear has crept in. The fear is so much that they're just worried even to step outside home. They feel that they're going to have COVID if they go outside home. The panic has set in. We have seen examples where some of the migrants, when they went back to the villages were not willing to, allow them inside. Now, there is a shock. There is anxiety. There is depression, and there is stress. I was also reading about the sort of stress for those employees who work from home also. So today, there is a need to address these mental health issues from a more comprehensive view, a holistic view, and we need to have some innovative practices and innovative interventions. I think Dr. Tatiana has brought out some of the interventions we can have, and I'm very sure that we are going to be looking forward to many more discussions during this seminar. With these few thoughts, I leave it open for 3 days deliberations. I hope that those experts who are going to be talking will come out with many more solutions to the existing psychosocial problem that is created after the COVID situation. Thank you all.
Thank you, sir, for briefly and rightly focusing on the current situation and mental health. The final felicitation will be given by Dr. Prince Anadrai, the Associate Professor of the Department of Social Work, Madras Christian College. Sir's areas of expertise include public health, social work research, environment, community organization, family and social work, adolescent and children. Sir was the Dean of Student Affairs, Madras Christian College from the year 2017 to 2019. He is also one of the main program organizers of this webinar. I request you, sir, to give the felicitation.
Hello, everyone. The global pandemic COVID-19 has affected people around the world with multifaceted issues. It is changing several paradigms of mental health locally, globally. It demands for newer understanding about mental health perspectives, like the causes, symptoms, and interventions of mental health. The COVID-19 is not merely a physical illness. It affects the health of many directly and indirectly. It calls for global interventions from mental health professionals. This international webinar is one such initiative by the Department of Social Work at Madras Christian College, along with the Center for International Social Work under the aegis of Madras Christian College, also with the Commonwealth Organization for Social Work, UK. In order to have global knowledge sharing in the trends of mental health across nations, we have with us experts from Caribbean, Americas, Africa, Europe, Asia, and Pacific. All over the world, several countries are making their best efforts to invent a vaccine for COVID-19. A similar situation has emerged now to deal with the problems of global mental health. This is the rationale for organizing this international webinar. On behalf of the organizers from the shores of India, we thank all our partners, distinguished resource persons, participants from India and abroad, students of Madras Christian College who are helping in organizing this Herculean task, and the technical team. I sincerely thank all of you. I'm sure that the outcome of this webinar will give us new insights, which will be truly meaningful and practical. There is no health without mental health. Let us learn from each other's experience and let us support one another to deal with the new paradigms of mental health problems and possible interventions. Once again, my sincere wishes and appreciation to all the people involved in this webinar. I hope it will be delightful and significant learning for all of us. Thank you.
Thank you so much, sir. We have come now to the end of the inauguration. Before we move on, I'd like to give a few general instructions to the participants. Please ensure that your audio and video is muted. For those in Zoom, please post your questions in the Q&A box and in YouTube, the chat box. It will be answered at the end of the session. An attendance link will be shared at the end of sessions on each day in both Zoom and YouTube. Kindly fill them because the certificate will be provided only for those who attend all the sessions. In this international webinar, each day we will have speakers from 2 continents. Today, the content will be shared from Caribbean and America. The chairperson for this session are Dr. David N. Jones, COSW representative, and Dr. Godfred Bowen, the Policy, Research and Practice Improvement Lead of the British Association of Social Workers. I request you, sir, to take over and chair the session.
Hi, Bula. Thank you once again for the introduction. And I want to say another thanks to all the speakers. The next session, what we're about to see is a recorded video about which really captures some of the issues around COVID as experienced in the Caribbean. This was pre-recorded last week because we could not really get around the time zone issues, the time difference between India and the Caribbean. It really wouldn't work out for them to join us live. So it was pre-recorded and would be played shortly. There are 3 speakers in the video. The first speaker in the video is a Dr. Emin Bell, who is a consultant psychiatrist from Barbados. The second speaker is Mrs. Sharon Rose Gittins, who is the president of the Barbados Association of Social Workers. The third speaker in the video is Dr. Letney Rock, who is the acting head of the Institute for Gender and Development Studies, the University of West Indies. They will share the experiences of how social workers and other allied professionals have managed COVID in the Caribbean. I will be chairing the session, and I'll be on hand to answer any questions that you may have after the video has played. So please continue to engage with us through the Q&A box and the chat box, and I look forward to interacting with you that way. I'll hand over to Bula now and the technical team for the video to start.
Hello, everybody, and welcome to this webinar for the Commonwealth Organisation for Social Work in the 70th year of the Commonwealth. And we've got a group of really distinguished speakers from the Caribbean who are going to talk to us about COVID and disaster. Hello, everybody, and welcome to this historic webinar for the Commonwealth Organisation for Social Work in the 70th year of the Commonwealth. And we've got a group of really distinguished speakers from the Caribbean who are going to talk to us about COVID and disasters in just a few moments. But first, I'm going to ask Godfred Bowen, who's been very involved with me in the Commonwealth Organisation for Social Work, to say something very quickly about this webinar series. Godfred's in London and I'm north of London. So over to you, Godfred.
Hi, good afternoon to all our audience. My name is Dr. Godfred Bowen. I am the Policy, Research and Practice Improvement Lead at the British Association of Social Workers. Part of my role also involves some international social work, and I assist the Commonwealth Organisation for Social Work to promote social work values and policies that really would engender good social work practice within the Commonwealth. I'm really excited and delighted to be involved in this work, which is focused on sharing professionals, policymakers, and social workers from across the Commonwealth, sharing their experiences of practicing with those who have been unfortunate enough to contract COVID-19. As we all know, the pandemic, it's a global pandemic, but it's had really stark impact across the world, and it's also moving across the world at different speed and different rates. So it's really important for us all professionals around the globe to share our experiences of managing the pandemic. So in addition to this webinar involving experts from the Caribbean, there are also webinars involving experts from Commonwealth countries in Europe, Africa, Asia, and the Pacific. And so we hope that our audience find this useful and points of reflection, and also points of learning about new interventions for COVID. And we want our audience and everyone also to engage in dialogue with the speaker. So send us our questions, or send us your questions after you've had the presentations, and we'll endeavor to answer them. So I'm delighted to pass over to David, who will introduce our speakers.
Thank you, Godfred, for setting this up, and the Madras Christian College as well for giving us the opportunity. I'm a member of the Commonwealth Organisation for Social Work Board, and Godfred and I work with the Commonwealth Secretariat to make sure the voice of social work is heard in the Commonwealth. And really important Commonwealth countries are in the Caribbean. And now it's my real pleasure to introduce some friends and colleagues from Barbados who are going to talk to us about COVID and disasters and mental health. So we have three people. Dr. Ermin Bell is a very well-known psychiatrist in Barbados, a consultant, and who's known for speaking out about the impact of mental health issues and the importance of mental health issues in Barbados culture. Was recently in May quoted as talking about the stress of COVID for people who are testing and the uncertainty, the worry about living with the uncertainty of COVID. So thank you very much, Dr. Bell, for joining us. We have Sharon Rose Gittins, who is the president of the Barbados Association of Social Workers, a small but very determined and high quality group and in the Caribbean network. And really, thank you, Sharon, for taking on the role of chairing the association. And you work in the welfare department in Barbados, and you are also a nurse as well. So you've got multiple qualifications. So that's really good background for this session. And my long-standing colleague and friend, Dr. Letney Rock, who's got a hugely distinguished career, currently heading up the Institute for Gender and Development Studies, has been involved in Disaster Risk Reduction Centre in Barbados, is in the social work department of Cave Hill campus in Barbados, and in addition has been very involved in the International Association of Schools of Social Work, the Sustainability Committee and the Human Rights and the Projects Committee. So we're really grateful to colleagues for having organised yourselves at very short notice, really, for doing this. So we're starting with Dr. Bell. Our thanks to colleagues in Barbados. I'm still amazed that these technologies work, but let's hope everything goes smoothly and we can share our screens. But Dr. Bell, it's over to you, and thank you.
Thank you very much, Mr. David Jones, and I want to thank the organization for having invited me to share in this event. To me, it is very important for us to be able to allow ourselves to give insight to each other, and particularly mental health professionals and social workers, because their work is so much intertwined. So thank you for having me on. I am going to be dealing with the topic which was sent to me, and I'm trying to get my Zoom to come up on the shared screen.
I saw the slides just a few moments ago, so they're definitely there.
I think we are here now.
We are.
And as you can see, the topic for today is trends in global mental health against the backdrop of the COVID-19 pandemic. And I must say that we have all, none of us can say that we have escaped this particular situation. It has really been very tough on everybody. But I have some good news, because as you all know, mental health is an area that often has been neglected in relation to physical health. And we are very prone, as we used to say in Barbados all the while, that mental health is a poor relation to physical health. But the good news is that it took some countries, in the light of COVID-19, a few months, which is really remarkable because sometimes it takes years, to recognize that mental health needed to be addressed in this pandemic as an integral part of the management of the pandemic. Thankfully, from the early 1950s, countries across the globe started recognizing that there was a need for a different approach to mental health. And this movement, which, as I said, started after the World War II, really was geared on understanding mental health better, and the whole initiative of mental health reform started to take its shape. The understanding that the stigma associated with mental health needed to be addressed was very, very important, and I just wanted to make sure that people understood what stigma does. Stigma has been the main reason for the neglect of persons suffering from mental health issues. Stigma has led to the creation of mental health gap, which causes persons with mental illnesses not to access the treatment they are so badly in need of. So I just wanted to put up again a little bit more to reinforce the whole idea of stigma, and you can see that it is clearly playing out in other parts of the world, that stigma really does tend to deter the public from wanting to pay for care, and reduces the consumer's access to resources and opportunities for treatment and social services. And this came from the Surgeon General's report as far back as in 1999. As a result of stigma and discrimination, mental health is always a late consideration and often a last resort in the management of health. I just wanted to also say that the World Health Organization, since 1995, zeroed in on the thinking that mental health is more than mental illness. And this is really very important. Their definition states that mental health is not simply the absence of detectable mental disease, but is a state of well-being in which the individual realizes his or her own abilities, can work productively and fruitfully, and is able to contribute to his or her own community. And all of that, of course, is very, very crucial to the recovery of an individual with mental health problems. The mental health reform thrust, therefore, was propelled out of this initiative, and the community interventions have become very important. In the Caribbean, from the Bahamas, Jamaica, and Antigua in the north to Barbados, Trinidad, and Guyana in the south, mental health clinics have been established in our primary care settings. This has caused us to think of mental health as preventable as well as treatable. This approach has led to decreased persons being taken into custodial care. In at least one country in this hemisphere, Belize, there is no longer a psychiatric hospital. And in Belize, all mental health interventions are managed in the community setting. This approach has opened our eyes to the links between chronic non-communicable diseases and mental health. And the benefits of the trends in global mental health management of COVID-19 can be linked to what I'm talking about. Mental health reform, the wellness approach, the public health approach, and mindfulness have all contributed to the better handling of the COVID-19 pandemic in many countries. The Caribbean experience involved the embracing of known medical facts about the spread of viruses, implementing swift education of the entire population, the introduction of protocols, all with the aim and the goal of reducing the spread of COVID-19. I want to put the definition of mindfulness at the bottom here, because a lot of people talk about mindfulness, but they don't necessarily think about what it really means. Mindfulness is the basic human ability to be fully present, aware of where we are, and we are also what we are doing, be aware of what we are doing, and not overly react or become overwhelmed by what is going on around us. And in that context, you can think seriously of COVID-19. We were thrust into COVID-19, and our countries had to do very specific activities to try to help ourselves to survive. When you have a country of 166 square miles and a very dense population as ours is, you can imagine how easily it would have been for this virus to spread. Also, we are very tourist oriented, And therefore, had we not closed our borders, we would have been in serious problems. So the borders were closed, and this is for other Caribbean nations as well. Shutdown of all but essential services, curfews were established. There was promotion of physical and social distancing, and I like to do that separation because they are different. Reinforce good hygiene by educating on hand washing techniques, washing and wearing masks, washing one's face, that should be, and wearing masks in public places and gatherings. Enforce measures to protect the older populations and those with pre-existing conditions. These were two areas that were identified, two populations that were identified as being very vulnerable. Once COVID-19 reached our shores, quarantine, isolation, and contact tracing were put into action, which are all public health type initiatives. This involved infrastructural changes to accommodate the impending needs. COVID-19 was recognized as a rapidly spreading deadly disease from the inception. Death conjures up fear. Fear causes stress and anxiety. No one in the society, from the very young to the very old, can escape the fear and stress and the anxiety that COVID caused, and is still causing. This physical illness leads to psychological, emotional distress, and in some cases to psychiatric illness, with the development of major psychiatric disorders in some persons. We therefore have to address every COVID patient as a whole person, addressing physical, mental, social, and spiritual aspects of each individual. So COVID-19 mentally impacts everybody, as I said before, the patient, the family members of that person, the community members of the person and their other associates in the work situation, church situation, and all the other areas that they commune in. The frontline and essential workers, family members and close friends of these workers, older persons, persons with pre-existing conditions, the workforce and other displaced persons, parents and caregivers as example, children, adolescents, and young people. And I wish I had a lot more time so that I could go into the situation with each one of those groups, but I think then I would be sadly going very much over time. The lessons learned and to be embraced by, let us not go so fast. The mental health approaches to managing COVID-19, we need to embrace positive thinking instead of negative thinking. And that, I think, has been a serious lesson for most of us. Just don't wallow in the negativity. Adhere to behaviors and protocols which will keep you safe. Keep busy and maintain some routines to keep your brain active and not again allow you to wallow in the negative. Use some medium to keep you connected to others like Zoom and all the other Instagram and WhatsApps and all the other types of situations that we do enjoy. And you must keep up with those who are close and around you. Work on and develop new hobbies. And I think that has really brought up a lot of very interesting things in people who thought they had no skills. Try to decrease exposure to depressing news, which can be really horrific at times. Do not neglect your physical health and your needs. Share your fears and anxieties and ask for help if necessary. Connect with your spiritual self. Learn and indulge in saying thanks. These are all very important. And the lessons learned and to be embraced. Continue healthy habits and behaviors. Be prepared for any eventuality, any situation whatsoever. Recognize that our world is small. The globe is small. And what happens in one part definitely can impact on you in a very distant part. Educate your citizens, keep them aware and allow their input in major decision-making involving their health. Do not become complacent about the management of health situations. This includes your physical as well as your mental health. And I will just end by saying, I don't know how long I've been speaking, there is no good health without good mental health. Thank you very much.
Thank you very much for that phenomenal overview in such a tight time frame. That was really very informative and helpful. Thank you, Dr. Bell. Lessons there for us, and it's just amazing how the same messages are being relevant all around the world, all around the Commonwealth. Sharon Rose is going to talk to us about some of the social work responses to the situations described by Dr. Bell. So Sharon Rose, over to you. Good luck sharing your screen.
Thank you. And thank you, Professor David Jones and your visionary team for my presence here, a Barbadian social worker. It's the Barbados Association of Professional Social Workers, to sit among the other distinguished panelists. Just really, really words of thanks. So let's take it now over to my screen and let us go through. And I think we have all recognized that it is the Commonwealth Mental Health Webinar 2020, and it's definitely about exploring the benefits of such a webinar. COVID-19, Dr. Bell shared some of the terminology, and some I'm sure we have heard more now than ever: pandemic, curfews, isolation, lockdowns, suspended protocols, and quarantine. These are new terms, or terms that were always there, but having come under COVID-19, they have definitely blown up quite a bit. But the one term that I want to zoom closer in on would be the frontline worker, or the essential worker, for our social workers to be a part of. And these terms, as you would recognize, the COVID-19 timing to our region, I want to say in Barbados on March 17th, that was the date our first person was diagnosed. Also was the date in which we celebrated World Social Work Day 2020. And it speaks of promoting the importance of human relationships. And I found it a very powerful message as a social worker going through COVID-19, because then those human relationships that we're looking at, would have been new relationships being formed. We now needed to look at the unemployed or displaced worker. We also now look at the social worker closer, because now the social worker is also a parent. And then you also have the social worker with fellow social workers and the importance of networking. And then, as you will recognize, you also had now a situation where you look at the social worker from their family of origin now becoming and having responsibility for their parent or even their sibling. And obviously with COVID-19, you found that these relationships became stronger. So how were we blending the code of ethics with the COVID-19 protocols? And as Dr. Bell has also shared, we separate the social and physical distancing. We're encouraged to use the hand hygiene, respiratory hygiene, and now the wearing of personal protective equipment. Expected then, social workers became fearful, isolated, fatigued, and even worried at some point, but yet competent enough, because social workers are change makers. So even in those feelings of inadequacy at times under COVID-19, we knew for sure that we needed to do the work and we can get the work done. So it was a matter of retooling, and I will share with you some of the areas that we got into. And obviously building on the strength perspective, we built on the strength perspective. What do we have? Under COVID-19, you felt there was more engagement in telehealth. So the telephone and the online platforms, just as we are now, became a new instrument of practice. Collaboration with various government and non-governmental organizations, as well as community-based organizations, started to become our norm. to reach the new vulnerable groups and community efforts that were emerging, because it was no longer just a dependency on governments, but you had charities, you had different individuals themselves reaching out to help and to give assistance primarily on those basic needs of the individual. What the social workers also did became the voices on new helplines. We have a multidisciplinary team, mental health team, which is manned with psychologists and social workers on the ground, and we link and offer that psychosocial support to persons, both persons and their families in isolation or even just to manage that anxiety. Added to that, we also had a helpline created to offer persons an opportunity to call in, decide what their needs were, identify their particular needs, and as a social worker, then we were linking them to the resources to supply and meet that particular need. I also want to highlight as well that we frame partnerships, because with the pandemic also came certain social ills that we deal with, yes, on a regular basis, but with the pandemic, we saw that most of them some of them really seem to have exacerbated, such as there were issues of gender-based violence in some countries as well. We also had higher incidence of suicide, and I have left one particular area blank because I do not think I will capture all, and there may be some area that you who's watching and listening can actually add to that square. So I just wanted to highlight partnership, collaboration was critical, and obviously the adjusting to this telehealth and telecare was something that we really had to deal with. Ultimately, I want us to understand that as we continue to provide the support, because COVID-19, I think we've all agreed, is here to stay. And as we continue to provide the support, that has taught us also that we need to pause. We don't need to keep going and going, but in our lives, there's that need to pause. And yes, there have been many steps to be made in the future of our social transformation as we reframe and redesign social work. For social work lives matter, and in COVID-19, I think many of us will say there were moments when we could not breathe. We were worried as parents whose children could no longer attend school. We were also concerned on fast tracking and learning the G Suite that was offered here and the whole online teaching that was taking place. And then we ourselves as children within our families, or not knowing how our families were, and obviously being informed and knowing that there are Barbadians across the globe, and some of those are ourselves family members. We also worried for ourselves. Am I doing a good job? How do I prioritize? How do I select? But ultimately, whatever decision was made, I think most of the social workers recognized that it was a decision that had to be made. So between 2020 to 2030, it is my hope as we push the social work agenda forward, coming out of the conference, I think there are three critical areas that I would love to see push the social workers and the advocacy. And one is a mental health day, which allows the social worker compulsory time off to just engage in whatever reflective area they want to be part of. I'm also asking, I'm not sure if it is something that's offered in other countries or other states, but where the frontline worker, the essential worker, the social worker out there who is providing that care be given a hazard allowance. And then the third area that I want to share is that of self-care. And I want self-care to be one in which social workers themselves purposely engage in self-care with absolutely no regret. Thank you for listening. And as I would say here on this platform, as an e-social worker, for your actively listening to my presentation.
Thank you, Sharon Rose. It's a really helpful overview of the impact of living and working in this environment, and for you to draw that parallel between breathing in the current context is a very powerful, it's almost shocking, but it's important to look to ourselves, and perhaps we'll come back and talk about that later. So thank you very much. And full of respect for those of you who've kept on remaining in contact with people, and that has taken a lot of courage for a lot of people, which hasn't always been recognised. Dr. Letni Rock is now going to talk to us, and I think, Letni, you're, among other things, you're going to draw us into some comparisons with other disasters and what lessons we can learn from your substantial experience and writing about disasters in general. But Letni, over to you. Thank you very much. You need to unmute, Letni, because we can't. Letni said she wasn't using PowerPoint, but we do need to hear you speaking. So
yes, thank you, Chair, and special greetings to my colleagues from around the world. And I would like to thank Dr. Bohen and Professor David Jones for inviting us to be part of this webinar on mental health. Now, I will be speaking to you on the topic of social work responses to natural disasters amidst COVID-19 with reference to the Caribbean. I will try to include in my brief presentation how social workers in the Caribbean region should prepare for an emergency such as a natural disaster during this COVID-19 pandemic. Now, COVID-19 came upon us unexpectedly. It is not only a health pandemic, but it is a health disaster event for the world. And it has required global, regional, national, and community intervention. And it has impacted our social, economic, and political environments. Dealing with COVID-19 and its uncertainties has demanded that emergency measures of a social, economic, and public health nature be taken by the global community. The pandemic has impacted individuals, families, and communities in significant ways through increased loss of life, higher levels of unemployment and homelessness, increased reports of persons suffering from mental health issues, including suicides through loss of finances, acute stress, increase in family violence. And there's now that heightened vulnerability of the elderly, persons with disabilities, and those with chronic non-communicable diseases who, having been told of their high risk to catching the coronavirus, are now living in fear with curtailment of many of their daily activities. And COVID-19 has thrown governments and their citizens into a tailspin as they try to get a handle on the pandemic, which has now given rise to what is being called a new normal. For social workers, it is about adapting to a new mode of working with clients while being effective helpers. Now, most governments, with advice from the World Health Organization and their own scientists and health personnel, are making COVID-19 a priority, but they cannot afford to lose sight of other possible and impending threats, such as natural disasters, particularly those brought about by climate change. For example, during the height of the first wave of COVID-19 in Bangladesh and India, these countries experienced a dangerous cyclone and severe flooding. Now, how will we manage another emergency on top of COVID-19? Situations like these become what we say in Barbados, what we say, a sore on a boil, or generally speaking, a crisis on top of a crisis. Now, the Caribbean is a geographical area that is prone to natural disasters of all kinds. And therefore, we must have a ready disaster management response. In Barbados, Saturday Sun newspaper of May 9, 2020, there is a brief article entitled, "Virus May Limit Region's Response to Hurricanes." Now, in this article, the former executive director of the Caribbean Disaster and Emergency Management Agency noted that he feared COVID-19 would be the limiting factor in the regional disaster response, because the amount of money Caribbean governments have been forced to spend fighting the COVID-19 pandemic may limit their capacity to respond to any major hurricane disaster in the region in 2020. Like COVID-19, hurricanes, floods, earthquakes, landslides, cyclones, tornadoes, they all come upon us unexpectedly, and they are catastrophic. So one may ask, is the Caribbean, which is off-slammed by hurricanes, ready for the 2020 Atlantic hurricane season, which is predicted by scientists to be above normal in terms of active hurricanes? Now, in my research, I found that the New York Times had carried an article with a headline which read, "Caribbean struggling in the pandemic, braces for hurricane season." And this, of course, was written at the beginning of the pandemic. The article, however, begins by saying that scientists predict this hurricane season will be severe, but countries in the region, that is the Caribbean region, with economies burdened by the pandemic and the devastation of past hurricanes, have not been able to fully prepare. So in this hemisphere, where the hurricane season started just last month and will last another 4 months, that is until November, COVID-19 is predicted to last beyond November. Are we mindful that Caribbean countries, small developing states with scarce resources, who are currently trying to prevent a health pandemic from invading the Caribbean, that their efforts can be complicated by another major natural disaster at this time, and that such a disaster will exacerbate burdens on our countries and economies? It's a big question. But for us as social workers, are we preparing to deal with the possibility then of two emergencies? Will we be able to cope with what could come our way? We can just cast our minds back to the recent hurricanes Maria, which devastated Dominica and Barbuda, and Dorian, which devastated a significant part of the Bahamas, to visualize how the lives of people in our region can be rearranged overnight. These crises exacerbate the vulnerabilities that exist in our Caribbean societies, some of which are still recovering to recover from those recent disasters. Now, following natural disasters in the Caribbean region, the mental health needs of those impacted, and this is what the research has shown, is likely to be overlooked due to the scarcity of psychosocial professionals. However, psychosocial support, as we know, is necessary to reduce the heightened feelings of anxiety of the survivors. And so failure to address adequately these negative psychosocial effects of post-traumatic stress, depression, panic attacks, acute stress disorder, and alcohol and substance abuse among survivors can really be detrimental to their recovery if they do not adopt, if they do adopt inappropriate coping strategies. Fortunately, we know that many people in our Caribbean states are resilient. We consider ourselves to be very resilient in dealing with disasters. And we consider that a plus for us as we try to recover from such crises. So that being said, social workers in the Caribbean are well placed to intervene in disasters. We may not have the kind of training that we need to at a tertiary level to respond to disasters, but we have diverse skills to offer, such as psychological first aid and skills and a range of tangible skills that we can use for a range of tangible assistance. And so we as social workers believe that our efforts are going to be needed, our efforts will be critical to recovery. But can we respond effectively on a personal and professional level to an emergency created by a natural disaster in the midst of this pandemic, considering that few countries have the resources to meet the psychosocial needs of survivors? What are our priorities at this critical time? What can we do to mitigate? That's another question. Many countries have, including Barbados, have poorly resourced social service systems. We do have social service systems, we do the best that we can, but they're not adequate to meet the needs when disaster takes place. So have we formulated a strategic approach in our region based on the lessons learned from previous interventions by social workers in responding to natural disasters and other emergencies? As first responders, are we working with our local authorities to put measures in place to combat any major disaster that may occur? Are we integrated into the regional disaster response system of the Caribbean? And here I'm really speaking to the social work fraternity. Social workers in the Caribbean are almost certain to have to deal with a disaster in the region this year. So we must therefore feel confident and empowered about responding should a disaster occur. We must be resilient, confront our own vulnerabilities and fears about catching COVID-19, because if we are feeling stressed, burnt out, and scared, we will not be effective in helping others impacted by the crisis. And so this crisis, the current pandemic, demands that we protect ourselves and family. It demands that we effectively and efficiently respond to help those who are also impacted, as most of us work from home. However, we have to recognize that when there are two crises, then we have a lot more to navigate. So what can we do, therefore, to ensure that we are emotionally ready and that we have enough energy and enthusiasm for the tasks that may lie ahead? So as we confront our fears, I agree with Sharon Rose. As social workers, we also need to engage in self-care activities, refresh our social support networks while thinking about how to leverage our networks and connect to social workers nationally, regionally, and internationally to assist with our national efforts if needed. And I'm about to end at this point. It may be a little late for our countries to introduce new integrated measures to deal with a crisis on top of a crisis. But I do believe that as social workers, we need a different set of strategic considerations and policies when working in these unprecedented times in order to strengthen our response. In the meantime, it is imperative that we strengthen our partnerships, educate our local communities, and help to organize community members for emergency action while working with our local emergency departments and readying ourselves best as we can for any threat that may come, cognizant of the fact that as social work professionals, we cannot operate in a vacuum or on the periphery of our societies. Thank you.
Thank you, Letni, for that very powerful overview. And we've got about 10 minutes, Godfred, I think, for some conversation.
Yeah.
And I was interested in the self-care. I was interested in the community dimension that you touched on at the end there, Letni. If we just pick up, and there may be some other issues, but if we just start very quickly, and we're going to have to be quite brief about each issue if we're going to cover a number. But the IFSW Global Workforce Research, which was the first results of the pilot study were published in the conference last week, suggested that worldwide, social work as a profession is in the bottom 25% of positive working environments. And it is shocking that a profession which is based on understanding people and relationships and the importance of that appears to find it so difficult to facilitate the self-care which you've talked about, to provide the nurturing environment that is necessary to do the very difficult work that Dr. Bell and Letni and Sharon Rose have talked about. And I'm sure that isn't because managers and politicians want to be nasty to social workers, but it's the pressures that are put on people. But we've got to change that if we're going to avoid the mental health crisis that Dr. Bell was pointing to. So I wonder about the working environment that we're in, just very.
Due to lack of time, I think we'll cut short the session. I request Dr. Godfred to take over the question and answer session.
Thank you so much. Thank you so much, Bula. I mean, there's so much from those presentations that I'm sure we would like to discuss if we had the time, but sadly, because of the pressures of time, we need to consider bringing the session to a close, and we have time to take 2 questions. And my sincere apologies to our audience who have engaged so actively and have been sending their questions to the panel, but regrettably we're unable to answer all of them because of the pressure of time. And as I've said, we have time to take 2 questions. What I will do is I will answer the 2 questions, and I'll ask also my colleagues, Dr. Prince and Dr. Sylvia, if they have any points to add from the MCC perspective. So the first question that I will answer is a question posed by someone via YouTube, which is, this is the question: how can educators help students improve their mental health in this traumatic situation? And firstly, that's a really, really important question, because one feature of social work is that as a profession, whilst we try to address the mental health needs of the people that we work with or service users, unfortunately, the profession is not as strong when it comes to addressing the mental health needs of the workforce. And I want to use an example from Britain, the UK, to highlight this. I'm not saying by any means that that is common across the globe, but I'm just using the example of Britain to highlight this. The British Association of Social Workers have been involved in a really large-scale research of the social work workforce to understand some of the mental health issues that the workforce faces, bearing in mind that the research was conducted before COVID. Some of the issues that the social workers highlighted in that study, and the study involved over 3,000 respondents to a survey question. Some of the issues that they highlighted were really high caseloads, that essentially more work than the workforce is able to deal with, questions around pay, questions around bureaucracy and paperwork within the workforce, and also questions around how employers address issues around moral distress. And the profession has traditionally hasn't been so good at addressing these issues. So back to the question then around how can educators support students to address their mental health? Key issue for me is this. One, I think the presenters from the Caribbean have addressed a number of those issues. Both Dr. Emin Bell at the end of her presentation and Mrs. Sharon Rose Gittins, again at the end of her presentation, explain some of the self-care strategies that we can use. But another point which was not highlighted in their presentations was the role of supervision supervision as a vehicle or as a context through which educators can really address the mental health needs of their students. So rather than supervision highlighting or being focused predominantly on the academic dimension of the training programs, educators can also use supervision as an opportunity to really ask students how their mental health well-being, and also some of the support that they believe that they require to address those issues. Those are the immediate thoughts that occur to me, mindful that I'm talking really from the UK perspective. I do want to hand over to my colleague, Dr. Prince, and also Dr. Sylvia, to see if they have any additional thoughts to add to that. Otherwise, I'll address the second question.
Thank you, Doctor. What happens in our curriculum in Madras Christian College, we have exclusive session and training program on self-care to social work students. So how they need to take care of themselves in field work especially, and also when they go up for research or any such social work assessment like home visits. So we train them in the beginning itself about the self-care. So that is integral part of social work curriculum in MCC. We have learned this art of the self-care mainly from our students from abroad. When the interns from other countries and other universities, foreign universities, when they come to Chennai, they have a protocol to follow as per the self-care provisions, perspectives of their university. So we have formulated such self-care things. For example, when the students, when they come here, when they are so fond of playing with the pet dogs, street dogs. In India, the street dogs and pet dogs are a serious concern, matter of serious concern. So they have a question, can we play with the street dogs? Can we feed the street dogs? We say that, according to the protocol given by the university, you are not supposed to play with the street dogs or feed the street dogs. So such things, even gender issues like when they are traveling in this public transport system like public train or buses. So we have separate seats for men and as well as for women. So we even such minute details we address to the students. This is one way of dealing with the self-care that also enhances their mental health. At the same time, when they have an issues, immediately we need to listen to them and address that. So that is another thing that we have learned here, mainly from our own experience. Thank you.
Thank you, Dr. Prince. That's really, really helpful. And just to conclude that question, I think also one way for us to approach the question of supporting students with their mental health during this period is we need to think or consider two issues. One is what are the specific mental health issues that have been caused by COVID? On one side. And then the second point is what are the long-standing issues with social work training that lead to mental health difficulties for students and also those in training, and how do we address them? So there is that specific issue around COVID, which might be temporary as the pandemic eases, but there might also be long-standing impact of COVID on on students' mental health that we need to address. And then secondly, what are the long-standing issues long-standing issues around mental health that would exist irrespective of COVID anyway, that ought to be addressed. And Dr. Prince, I'm really heartened to learn from you that the social work curriculum at MCC contains a specific element of self-care training for students. I think that's one thing that our colleagues in social work education around the globe can really learn from. And I certainly, from the UK perspective, has learned from that, and I'll be sharing it with colleagues here. The second question is broadly around how can we, as social workers, how can we ensure that mental health issues are accorded the same priority as physical health issues around COVID, during this period of COVID? I think that's a really important question, and I alluded to some of the solutions in my own presentation, that globally, and certainly in the Commonwealth, we tend to prioritize physical health conditions over mental health conditions. And within COVID, for instance, COVID particularly, it's important for us to recognize that some of the mental health impact of COVID might itself lead to people contracting COVID. Let me use one example. People might, for instance, develop mental health conditions as a result of social distancing. That might cause them stress, for instance, that might amplify certain existing mental health conditions, as a result of which they might want to, if you like, break out of the lockdown. And that itself might expose people to particular mental health, to particular risk of contracting COVID, I beg your pardon. So a key issue for us as social workers and as also practitioners is really to recognize the link between the two instead of treating them as separate entities. So that's one point. A second point is that in all our work with service users, we need to be assessing both physical and mental health, because that's the only way that we can identify how COVID is impacting on their mental health, and at the very least start to identify how they can be resolved, even if some of the solutions might not always be apparent. And then thirdly, I think for policymakers and for researchers and educators, we really need to advocate for what we call in the UK parity of esteem. We really need to advocate for national governments and national policymakers to see the link between the two, rather than seeing them as completely separate entities, and that the two of them have to be addressed in tandem. So those are my initial thoughts around that particular question about how we sort of advocate for the recognition of mental health as an equally important policy imperative as physical health. And I'll pass over to my colleague, Dr. Prince, to see if you have any thoughts on this from the Indian perspective.
Yes, doctor. There is no physical health without mental health. Physical health and mental health are inseparable. That is also many times emphasized and reinforced by WHO. If you see the social distancing in COVID-19 situation, it is not only social distance, it is also physical distance. So a country like India, South Asian countries, where the social cohesion is very high, the intensity of the interaction among the people when it is really high, the physical distance also leads to a lot of mental health ramifications. In fact, this COVID-19 situation has given us new paradigms in mental health. We need to really study evidence-based researches. We need to conduct. We need to address from a new dimension and directions we need to take. So there is plenty of opportunity. So we need to address the issue of COVID-19 not only as a physical illness. It has a severe mental health and psychosocial issues. So the question what we have, do we have health professionals to deal effectively with the physical health of the COVID-19 situations or the infected person? The medical professional and the COVID-19 affected, the ratio that alarmingly, that is, the distancing. If that is a major concern, the same thing for mental health, the professionals needed for addressing the COVID-19 situation or the persons affected, and the need, even Professor Tatiana in her keynote address, she was talking about the supply demand. So that is exactly a global problem, not only in the Asian countries, it's a global problem. Even in developed countries like UK, USA, there's a widening gap. So we need to study that. So now the situation is, even without that supply demand being met, somehow people are surviving. So if they are surviving, we need to find out what are the reasons for that. If it is not possible, why it is there, that we need to find out. So there is a much and great scope for research in these research gaps.
Thank you very much, Dr. Prince. That was really, really helpful addition to the discussion. Because of time, I want to now sum up and close the session. First and foremost, I want to thank our audience who have been actively engaged, who have interacted with the panel, and who have posed us such thought-provoking questions, which have really enabled us to expand on some issues discussed in their presentations, but also have left us with other issues that we need to reflect on going forward. What have we learned from the presentations from the experts from the Caribbean? I want to highlight three lessons. One is that we really ought to think about COVID-19 and the global pandemic as if it were a natural disaster, a natural emergency, one which was really unplanned and which has really impacted the world at full speed. What that means is that we can draw on the lessons of how social workers engage with people who have suffered or have been the victims of natural disasters. What are some of the mental health issues that result from natural disasters, and how have social workers dealt with them? So that's one point. And in answering that question, we can draw on lessons from our colleagues in Caribbean who have such experience of dealing with hurricanes and other natural disasters on such a more frequent basis than some of us do. The second point that the Caribbean presentations and papers highlight is that we as social workers whether as students or as educators or as policymakers and as researchers, we really have to think about our own mental health, the impact of COVID on ourselves, because we have also all experienced social distancing. We have also experienced workload pressures as a result of this. And then the third point that I would say is we need to engage in dialogue between the global South and the global North and share our experiences, because the pandemic is having different impacts around the globe. And on that note, I really want to thank all of you for engaging so actively in this session. And I want to thank the MCC team and also the technical team for such a brilliant job. I hope that you join us tomorrow in the sessions that we would be delivering on Asia and also the Pacific. Thank you so much and have a good evening. Bye now.
Thank you, Dr. Godfred. Thank you, Dr. Godfred and Dr. Prince, for the question answers. Thank you for answering it in both a global perspective and an Indian perspective. And also to Dr. Godfred for precisely concluding whatever we've learned today. Thank you, sir. And we've successfully come to the end of the first day of this international webinar. Thank you all for joining us and for actively participating. I want to especially thank all the speakers, even the speakers who couldn't be here today, but who took the time and effort to record the sessions for us. And thank you to everybody. And before you leave, the attendance link will be shared in both the Zoom and the YouTube. Please fill the attendance form. The Zoom will be open for about 10 minutes so that the participants can fill the form. And thank you all for being here today. And we'll all meet again tomorrow, same 3 p.m. IST for the second day of the conference. Thank you all. Have a good evening.